Thank you for everybody who's joined us so far. We'll just be hanging on for another minute or so while people join. Thank you. I think we can kick off. So hello everyone, and a warm welcome to this Patient Engagement Open Forum. This is one event of many events that take place throughout the year. If we can go to the next slide, please. All of you have joined today, and we're very pleased that you have. We would like to focus this meeting very much on building sustainable fundraising models in Central and Eastern Europe. My name is Nicola Bedlington, and I have the honour and pleasure of moderating today's session. As you're joining the meeting, it would be really great so we can get a sense of who is in the room. If you could just add your name and your organisation and country to the chat, that would be fantastic. Within the Patient Engagement Open Forum environment, we have a few rules of the game, rules of engagement that we'd like to apply in today's meeting. We would like to ask you to be present and engaged. All microphones will be mute. Please provide your specific questions to the speakers that you'll hear about afterwards in the Q&A function. But any comments or feedback you might have, please add that to the chat. The session will be recorded and will be available shortly. And let's try and make this workshop as interesting as possible. It's a really critical theme. Next slide. So we have an AI live translation tool, which you're willing to use if you need it. And I think the information on the Wordly translation is up on your screen. Just press open if you wish to use it and ignore if you don't. So just a quick glance at today's agenda. We will be hearing from Derek Mitchell from PFMD, the Patient Focused Medicines Development Initiative, who will be looking at bringing global and local together, sustainable funding for the CEE patient landscape. And then we'll hear from Ivica Belina, who is leading the umbrella organization in Croatia, CUTS, and he will be talking about challenges and change, the evolving funding environment for patient organizations in Central and Eastern Europe, homing in particularly on examples from Croatia. We'll then have a panel Q&A where we'll have the chance to pose questions to both Derek and Ivica. And then we'll have an all-important co-creation session exploring funding pathways for patient organisations in Central and Eastern Europe. And anybody who knows about the Patient Engagement Open Forum will know that this goes to the heart of our work. We'll be rolling up our sleeves and really working and thinking together in a co-creation session. And we'll be explaining a little how that works in a few moments. We'll then have the chance to have some reporting back from the 3 different breakout rooms, picking up the key ideas, and then we'll be having a little bit of a wrap-up and conclusion, and we'll tell you about some of the other Patient Engagement Open Forum online sessions coming up in the next few weeks. Next slide, please. So as you can see here, we have the 2 speakers, Derek Mitchell from PFMD and Ivica Belina. And so in terms of the objectives of today's session, we'd really like to raise awareness on the importance of diversified and sustainable funding models. We'd like to showcase successful case studies from the CEE region and beyond, highlighting lessons learned. We'd like to facilitate knowledge sharing between patient organisations, industry and broader civil society. And we'd also like to explore opportunities for collaboration to really build resilient ecosystems, primarily through the lens of fundraising. So without further ado, allow me to welcome Derek. Derek, thank you so much for making time to join us today and sharing your thoughts and experience. I have a few questions for you. Perhaps we can bring the slides down and I can see you all and Derek a little bit better. Fantastic. Good. I have a few questions for you, and I'd like to kick off with reimagining fundraising for patient organisations in Central and Eastern Europe. How can we approach fundraising more creatively and sustainably, in a region where traditional models are limited? And what innovative and collaborative entrepreneurial approaches could really inspire patient organisations to diversify their funding base?
Thanks, Nicola. Thank you for the invitation to join this webinar, because not only is this topic just so relevant and crucial right now in a world that is very much, for many patient groups, is in a certain degree of turmoil, but I think it's also a world that, for those of us at the global level, that we see this evolution as not only an opportunity for patient groups to move themselves into a different type of partnership mode. It's also an evolution in terms of the responsibility for governments have a responsibility for redesigning health systems, and that this necessity is something that patient groups can align with, because we can see patterns emerging from initiatives like what has resulted from the WHO resolution on social participation, which I hope some people have heard about. It was launched in 2024, and it does represent a shift by calling for more inclusive governance and participation in the design and delivery of healthcare. So we can see these negative and positive shifts from, I guess, the perspective of patient groups. And what we're doing as part of both PFMD, but also with our parallel initiative, which, Nicola, you're all too aware of, which is the Patient Movement Catalyst, which very much sees this as a need to create the resources and to encourage the connectivity between patient groups who are innovating in their own business models, so that their added value propositions can be co-created together and to learn from good practices. So within the, I guess, the Central and Eastern European region, as you say, the tradition of certain types of fundraising models has not been there, maybe in terms of what's available in other countries. I was struck last week by the venture philanthropy model in the US, where it, again, looking at patterns of wealth distribution, where a lot of the baby boomer generation in the US is actually transferring their wealth to a new generation who are more socially aware, who are more interested in investing in social enterprises that bring benefit to populations. And indeed, that represents an opportunity in the US. However, in Eastern Europe and Central Europe, that social entrepreneurialism is at a very early stage. But it's not to say that if patient organizations can raise their ambitions to look more long-term, that it's not something that they can be building value propositions for this type of investor community. So the types of new initiatives that are happening in the investment community, we've seen good positive inclusion of patient engagement criteria and metrics in many of the investment community who are interested in developing new solutions that are looking at these population-based benefits and to society. And if there's criteria by which these investors are measuring up certain types of innovations that include patient engagement as a necessity, well, then that's very much an opportunity for patient groups to really tap into those systems that that investment community are looking to reshape. And certainly something that I'm here at ISPOR in Glasgow, and during the plenary session at the very first day of ISPOR, this whole area of the investor community embracing patient engagement was front and center. So it's very obvious that this is a key area of interest for the area of which this board focuses on, which is around outcomes measurement. And if I think about the opportunity for that for patient organizations, it is that they could shift towards these new outcome-based models, whereby they can be utilizing the data that they've collected from their own memberships and articulating that into a way that is, I guess, attractive to these investment communities, because that's certainly the type of narrative, it's the type of proposition that they're interested and they're increasingly interested in. So that's my starter for 5 about where the source of these new potential funding models for those in systems that maybe or ecosystems that haven't gotten a traditional investment wing that patient groups can't necessarily tap into. But I would also add that there are examples, and I'm sure that we'll hear about them certainly in the Croatian context, but in other countries that we know that maybe patient groups can learn from. And certainly if I look at the case of Slovenia, we're working with youth groups in response to the WHO resolution of social participation. They were successfully made a funding case for public funding. And indeed, these kinds of examples that we're looking to collate and learn from in the patient movement catalyst, because that can provide a center point where a lot of these new funding models can be teased apart as to whether they can be relevant in other jurisdictions. So yes, there's plenty of opportunity on this call.
Fantastic. You've mentioned the patient movement catalyst a couple of times. Could you tell us a little bit more about it and what it's intending to do, and what lessons can be really drawn from organizations seeking to move from reactive fundraising to really build up long-term value-driven partnerships? Clearly there's the investment community, but other thoughts, other opportunities.
So the patient movement catalyst was actually born at PEOF. It was formed by a group of patient representatives and advocates and champions of patient engagement in 2022 at the PEOF event. And then it formed into a more stable, sustainable network that is incubated by the Synergist program, which also is the engine behind PFMD. And over time, since those early days, the patient movement catalyst, as the name actually describes, has become very much a movement towards catalyzing the types of change that is reflected in the ecosystem and the global health ecosystem, and is now translating it into the national contexts, but also the type of change that patient groups themselves want to see in terms of the recognition of their role as innovators, but also to put in place the necessary supports that would allow the types of capabilities to be built, but also the types of funding mechanisms that are appropriate in individual contexts. So it's very much a learning environment, learning from those who have been doing this already, providing a center point for patient groups to just see where maybe those broader, maybe civil society groups have been able to successfully achieve funding. And we'd certainly love to hear more examples coming from the Central and Eastern European sector and countries, so that we can learn from those models. So that's I guess the premise of the PMC, and certainly where PMC has been most active has been in responding to WHO resolution on social participation, and indeed the countries who have signed up to that. And certainly PMC were at the World Health Summit last month with a very strong presence around the connection between sustainability of health systems and sustainable patient groups, and making that link between the two is where an awful lot of, I think, the real value of being a member of the the PMC would materialize for patient groups in their own way.
Sure. So social participation and being an active partner in health decision making should actually go hand in hand with resourcing patient organisations to do the absolutely critical job that they're there to do. And for the patient movement, if you like, to have the same sort of access to resources as, for example, the women's movement, the environmental movement, civil society in those spaces seem to get more funding on a systematic and regular basis. So that's a really important aspiration to go for, Derek. So based on your experience, also knowing you for quite some years and your fantastic work in Ireland with patient organisations there, what practical insights can you share on building both financial and human resource resilience? Particularly,
Yes,
I think, in small and under-resourced patient organisations.
Yes, so some of you may know me from my time in IPOSI, that's the Irish Platform for Patient Organisation, Science and Industry. And as spending almost a decade as CEO there, we went through various cycles of funding challenges, but also some wins in terms of both grant-based, but also public and private sourced funding. So, and indeed, the diversification of funding, I think, is probably the key message that I would be bringing to this meeting in terms of the sustainability of patient organizations, that really having, you never really know where the challenges are going to come from in terms of whether it's publicly funded or privately funded or otherwise. So having that diversity of funding is crucial to sustaining the effort. What we learned in IPOSI was that the value proposition to both public and private funders needs to be very well thought about and continuously communicated to, because priorities do shift and you need to be ahead of those priorities in terms of the value that you're providing to if they're supporters, or if they're under a membership model, or if they're under a sponsorship model. It's always that active communication of your value as an organization, I think, is the key to maintaining that sustainability. And then forming very key relationships with public system, departmental, ministerial groups, I think was a key added value for IPOSI, because what they saw was they saw an added value in terms of the platform that IPOSI had created between patients, academic science, and industry. And what the value for the public system was that we were filling a gap that they needed to fill from a policy perspective. So by tapping into where maybe there's opportunity within the policy sphere to align with, it can be government policy or it can be departmental policy. That's where those nuggets of opportunity for additional public funding come in. So, but it's also very much knowing what value you provide through your platform or through your organization in terms of the outcomes that you maybe can measure. And certainly in our time in IPOSI, the patient groups who were able to do that through the development of registries or preference studies or other types of research initiatives which they were partnering with academic institutions with on, were very much the ones that were able to obtain sustainable funding, both public and private. And also, I think what IPOSI demonstrated in terms of a model was that you don't actually need to be afraid to look at private funding, because I think there is a fear out there that by somehow putting in place the correct governance and policies that allow for private support of what the patient group is ultimately driven to do, that is, I think, viewed with a degree of what I would call healthy skepticism. But it is very, very possible under models like IPOSI to ensure that you can build those longer term relationships. And I do believe that that companies and investors are looking to invest more long term and not in simply in in individual projects, because patient organizations and their role as trusted partners is something that I think that certainly in terms of the pharmaceutical and increasingly in the medtech and digital health sectors, that they see patient groups as very much a natural partner for building that trust in the types of initiatives that they're looking to bring into the system. So the way in which you can build those relationships with public and private partners through the guidances that are available through PFMD and other organizations. I know PEOF and Patty have been doing great work on this, and certainly in terms of even shifting those towards more tailored approaches within the Central and European region is work that's ongoing. So there's lots of templates and guidances and frameworks that patient organizations can avail of. I would encourage anybody to go on to the Synapse digital network, where you can gain access to an awful lot of these, but also you can gain access to over 9,000 users, individuals and organizations that are on Synapse to learn from their practices about how they're utilizing these tools.
Terrific. And I know from having worked with you, one of the USPs of iPOSI as a platform was and is that it is patient-led. And the big message that I've got from what you've just shared is that it's important that patient organizations have their own strategies, long-term strategies in place and their own priorities in place in order to be able to negotiate effectively with funders who are increasingly having a longer-term vision rather than having a bit-by-bit fragmented project by project. So that's really terrific. I've got one last question for you, Derek. What is the single most important piece of advice you'd offer to those of us who are really struggling to sustain teams and impact because of the crises that we're confronted with? What's your one big message?
I think stay the course and dig in. The role of patient organizations is absolutely crucial to the sustainability of health systems. And if I'm to give any message to those who are really struggling right now for any type of hope on the horizon for, I don't personally believe that there's a magical foundation out there or magical thinking that it is going to somehow drop out of the sky. What it will require is dedicated, staying the course with other patient groups, and to really leverage the networks that are there to be leveraged, like Patient Movement Catalyst, like PFMD, like EPF and Patty, because that's where ultimately your long-term sustainability as an organization will feed into. Because certainly in my time in iPOSI, we learned a lot, and I have to give credit to the likes of Patty in terms of the capabilities and capacity training that we were able to implement in Ireland had a real knock-on effect in terms of the perception of our organization as something that was providing value to the health system. Because once those educated patients were going out and getting involved in the system, that had a very much a positive knock-on effect for us. So by tapping into those networks and pan-European groups, that's where you can ultimately make your value proposition.
Fantastic, Derek. So collaboration is really the name of the game at all levels. We'll be coming back to Derek in a little while for a little bit of a Q&A. So if you've got any questions you'd like to pose to him, please pop those in the chat, or you can raise your hand as well afterwards. But bear that in mind, there's an opportunity to come back and dig a little deeper on some of the wisdom that Derek shared. I'd now like to turn to Ivica Belina, who will be talking about the evolving funding environment for patient organizations across the Central and Eastern European region, but also specifically in Croatia. As I mentioned earlier, Ivica is leading very successfully the umbrella organization in Croatia. A very big warm welcome to you. I know you want to share with us your thoughts, your hopes, fears, challenges and opportunities. Please, the floor is yours. Ivica, we're not hearing you right now.
Okay, I'm unmuted. Can you
It's
hear
fine
me?
now. We can hear you now. And I know that you are unable to access a camera, but we have a lovely photograph of you in front of us. So please go ahead.
Thank you, Nicola, and please warn me if anything goes wrong.
I will.
So, oh, thank you. So, hello, everyone. Well, it's quite challenging to talk about what is the funding scene for the patient organizations in Central Eastern Europe and also in Croatia, where I come from. But I will just give you a quick overview of what happened in the past, where we're now, and what are possibilities in the future, perhaps. So I think the golden era for all of us was the pre-accession funds for the EU, because that was the best time for civil society in its history in this part of Europe. But it ended, and most of us joined EU, which meant structural funds, and that was the first hurdle we come upon. And there is also a problem of insufficient funds from the governments, especially in Croatia. We now face the third year of lack of any funds from the Ministry of Health and from the health budget for patient organizations, which is very difficult because the sustainability of patient organizations is jeopardized, especially the smaller ones. And with this model, when we had funding from the state and then some individual project, which was talked about before, without broader picture for the long-term sustainability of organizations, lots of organizations face troubles. It's very difficult to maintain the workforce, and also the model of voluntary work is quite different than in Western Europe. So people are not so motivated to get aboard with patient organizations. At this moment, the space looks like this. From all the programs that are within EU for Health or within Horizon Europe are not actually accessible for patient organizations. So you have to partner up with some of the institutions for this. And this poses a challenge for patient organizations. Also, I mentioned the lack of funding on the national level, but there is very little funding for even individual projects from pharma companies at the moment. So what is there for us then? Everything is grim, everything is black. Is there anything that we could actually do? Well, yes. I think we really need to change our habits. And one of the things that we didn't address as much as we should in the past is fundraising in our own organizations as a crucial activity for the sustainability of the organizations, because it wasn't questionable in this just in this extension, and now it really poses a problem. So one thing that we really strategically need to think about is fundraising. And the other ones are the collaborations, which was also mentioned. So why I'm saying this? Because the way we actually managed to sustain the organization was through collaborations and getting on board with different projects as a partner, which are different research programs and educational programs and so on. which kept us alive. And I see here a great opportunity for patient organizations. Although I have to say we have one hurdle regarding patient data registry and so on, because we also, along GDPR, we have national regulation which says that the only institution that is allowed to collect any kind of health data on the citizens is Ministry of Health, and the organizations they vest the power in, which are very rarely patient organizations for now. But in terms of research of patient outcomes and patient-reported outcomes and so on, there is a really large field of work that we could do. There is also, for me, as an opportunity, the bigger possibility for actual advocacy, because when we were funded from the state, you were also limited in your advocacy work because you don't bite the hand that feeds you. And since it doesn't happen now, I think it gives us an amount of freedom to say what's really going on and what is happening on the field. There is also possibility of long-term projects on certain area of your work, which can include pharma companies, because now they're bound by the regulations to co-found activities, not to found the entire activities. So actually you can plan larger and address everyone who is potentially interested and invited to get on board. Of course, there is a possibility of fundraising with the citizens, doing crowdfunding campaigns, and some social being a social entrepreneur, but you really have to have a clear vision what you want to achieve. So I would just share with you the example of one organization, Nismo Same, or We Are Not Alone. Those ladies are women with cancer who actually organized transport for female cancer patients to the therapy and back home. And this is something that didn't exist from the start. And they started from nothing. They were funded by private donors in the starters, and now actually other cities in Croatia, like Rijeka or Split or Velika Gorica, are actually deploying part of their budget for these services, and they're paying for that services in their own cities. So maybe you should think about the good ideas and then go to the all possible people who can fund it. And one thing that I would say that is also neglected from our point are some regional calls for proposals. So we have different Adriatic Ionic region projects and Alps and Danube projects, which I don't think that many patient organizations actually use. But in the end, also with integration of care and the need that patients are, no matter what their disease or condition is, are re-socialized and included in the company, included in the entire society. Maybe we should also think about partner with different civil organizations who are not necessarily from the health space. So where the challenges, they were also mentioned. Derek was talking about governmentship of or the organization and the projects. When you partner with a strong research institution, it's very difficult to stay in control, even for the part that you're dedicated to. But that is also something that requires change within ourselves. So I think without a camera, without further ado, I will stop now. And if there are any questions, I'm really open to them. Thank you.
That's fantastic, Ivica. Thank you so much. You've given us a really very, very broad overview. And now I think it's over to our participants to pose any questions that you might have for either Derek or Ivica. Feel free to either put your hand up or add it to the chat. Any starters? And I can't see everybody, so if one of my colleagues can help me, that would be really great. I had actually a question stemming from the earlier conversation to you, Derek. You alluded to the value not only of public funding, private funding, but this whole idea of public-private partnerships. And we've seen many examples in a European context, in a global context. Could you perhaps delve in a little bit more about public-private partnerships and how you imagine maybe a national organisation in Central and Eastern Europe focusing on a specific disease area could engage fruitfully in such partnerships?
Sure, there's, as you say, there's many examples of public-private partnership. Some at the pan-European level. The ones that certainly that we're most familiar with are the Innovative Health Initiative, EPPs, and that's under the joint undertaking of the IHI. And that's where patient organizations are increasingly becoming full partners in these partnerships. Now, as has been mentioned already, you need a certain degree of capacity and capability in your team to be able to recognize where there's an opportunity for these funding calls that are coming through the European Commission and indeed the European pharmaceutical industry. But once you're in as a partner, I think that those partnerships actually, the value of being a partner of those partnerships is not actually only just about the funding, it's actually about the network that you are then able to leverage for purposes that maybe you didn't fully envisage when you first started into these public-private partnerships. And that's certainly been our experience. And if I look at one of those particular partnerships right now, the READY project, the IHI READY project, which is a long-term project looking at underrepresented and underserved populations in clinical research and how that can be improved. That's a 6-year project that has the most patient organizations that's ever been involved in an IHI project, actively contributing to not just the project itself, but actively contributing to the agency that patient organizations can collectively come together around to further the patient voice in the decision-making of the project, which again is a good example of a public-private partnership that's providing added value for patient groups. In Ireland, in terms of what we were able to do in an IPOSI environment, we saw that by including IPOSI as a patient-led partnership in initiatives that were designed to bring several different arms of the state in terms of the health service and the health research ecosystem, together with industry partners, that by having IPOSI as part of those partnerships, that we were invariably seen as the trusted deal breaker for creating spaces for honest, transparent conversations about the challenges that existed in the ecosystem. So that model of working, of encouraging the removal of maybe traditional kind of jacket-wearing adversarial approaches that very often happen between public and private partners, that the patient-led organization often ended up being that honest broker of those relationships and maintaining those relationships. And that was, again, an added value of having them in as a partner. So for any patient organization that's thinking about getting involved in any of the mechanisms that are there to promote public-private partnerships, I would definitely not underestimate what is involved and plan accordingly. It should be that you should not be doing this on the basis of just funding. This should be aligned with your own organization's vision and mission to provide for your members. But the added value that comes from being involved is huge, and it's maybe what you maybe weren't anticipating in the first place. So I can only advocate for anybody who's thinking about getting involved.
Fantastic, Derek. And building on that, Ivica, I remember you were recalling the complexity of large-scale research projects and perhaps the power imbalance with regard to the patient organizations and the researchers. And maybe there's a job of work here in terms of education, support, training in that context, learning from some of the successful public-private partnerships that have also gone through quite a lot of challenges in the first instance. Any comments on that, Ivica?
Yes, of course. But I think this is something that has just started, and there's a lot of room of first changing the scene and changing the awareness of all people included. When we talk about healthcare, of course, healthcare professionals and also the researchers were not really used to talk to patient organizations, and they're not really used to get significant answers from patient organizations, and even to take the needs of patients into consideration, because they have their own scientific drive, what they want to do and why should they do it. But if you face them with the fact, what is the actual benefit for the people, you will not get a straight answer every time. So maybe this is something that patients organizations actually have, and this is a huge capital alongside all the networks that we built throughout our work. And this is also a big capital that we can bring to the table, and we are the ones actually who can go and speak to anyone without fear or without doubt. And we are the one who can make the bridges between also researchers, healthcare professionals, patients, but also between public and private. And I think this is the richness, and this is the role that we're going to build upon in the future.
Great, thank you, Ivica. We've had a comment in the chat from Yannick in terms of investment vis-a-vis quality of delivery. Yannick, I don't want to put you on the spot, but I'd love you to come online and share a little bit more about your thoughts here.
Sure. Thank you for inviting me and for the really important topics and raising the questions, because we have more questions than probably the answers. But my question is more related to the everyday job for the how you manage, because for me personally, I have full-time job, and to manage the association, even to manage the funding for the projects is time consuming. That means that I have to do more to visit those pharmas and private companies. That means less my main job be done. I have to do it at night. So I am in this position this year where I am feeling that, how the others manage, because, I'm on the higher level where I'm thinking that I need to give up something. I'm not sure what it is at the moment. So, you know, I know there is a lot of opportunities out there, but still everything comes down to the time, and we don't have that time. Of course, when I have a big association, I have the worker, I can give him the job that this is your job to find the finance, this is the project, and take your time and do it. But mostly the smaller associations, there is one man show usually. And
Thank you,
even
Yannick, for that.
yeah,
I'm going to throw this back to our speakers because I know that both Ivica and Derek have been working over the years with smaller organisations in their own countries, in their own environments. Derek, first of all, what's your comment to this problem that I'm sure isn't in isolation with Yannick in Estonia, please?
Oh, it's not an isolated problem at all. And certainly having worked in as CEO of an organization that had a large membership but only a tiny executive secretariat, the big issue was managing time. And I think there are ways in which CEOs or directors of patient organizations can look at their time and see how it can be managed as effectively as possible. I've seen a number of small organizations look at use of digital platforms to really capture their time. It's almost embracing what you might call a business services model. And I know that certainly if you look at the large business services organization, their time is carved up in terms of down to the 20 minutes. And if you can get to that level of detail as to what degree to which you're utilizing your time effectively, it can give you the starting point for where you might actually find efficiencies through increased use of digital platforms. But also there's a number of digital solutions that are out there that I think small organizations are embracing a lot more in their operations. So without the kind of additional funding and resources, those kinds of efficiencies can actually lead to more headspace to try and figure out where the next funding opportunity is coming in. That would be certainly my experience of working on trying to be as efficient as possible with your time. Thanks, Derek.
Ivica, any thoughts from you?
I will try to be very short. Yes, there is a great difference between organizations who have people employed and who have people dedicated full-time and someone who has a day job and then runs an organization. And there is also a difference between organizations in what are their goals and what they want to achieve and how they function. So for some of them, it's enough to mark 2 days in a year, and that's enough. And they're present in the public and people recognize them. But I think that professionalization is the key for the ambitious organizations, because without dedicated people and dedicated time, in long terms, it's not feasible. So this is about strategic thinking of the organization, what do they want to do and where do they want to go. And with that comes people, time, and of course funds.
Great. Thank you, Ivica, for sharing your ideas around this as well. We're now, unless there are any burning questions, we're now going to move across to you, to all of you. As you know, the whole essence of the Patient Engagement Open Forum is co-creation. And so we'd like to now go into breakout groups and undertake a co-creation exercise. And what we'd like to do essentially is identify 1 to 2 realistic fundraising ideas, perhaps inspired by what you've heard earlier this afternoon. thinking about maybe public, European grants, local philanthropy, individual giving, cross-sector partnerships, foundations, etc. And once you've identified a couple of ideas, outline potential barriers and enablers, and suggest the respective roles of patient organisations, industry, and broader civil society.
Yes, I believe we do. I see Alona nodding, so I think we do.
Fantastic, that's great. So what we're going to do in the next few minutes is to have a little report back session and hear a little bit from each of the groups, the discussion, just a top level overview of key ideas, perspectives, etc. And so we'll jump into that now. Could we get feedback first of all from Group A? I don't know who's reporting back from Group A.
I think you need to give us guidance on who of us is Group A.
So I think you guys were the first group, weren't you?
So the group that looked at realistic fundraising ideas, that would be the first one.
Yes. Okay, sorry. Then I can report back team to comment. I think we took notes on everything that was on the board because the conversation went broader than that. But the two realistic funding ideas that we wanted to report back on are one, partnering across country. So we've heard a good case practice from Croatia, partnering with Spain and Portugal to get European funding. This was achieved through recognition from WHO and through the inclusion of initiatives from these three local organizations into a global registry. So the importance of networking and the importance of showcasing your initiatives was also highlighted. And the second opportunity we identified, and there was an interesting discussion, but unfortunately a couple of people had to leave for conflicting meetings before reporting back. The discussion was around how patient organizations, umbrella patient organizations, can gather local ones and together apply for European funding. And this could ease the challenges also of umbrella organizations, because we had someone representing umbrella organizations that was sharing how they are also small and struggle with funding and they'd love to help. And we brainstormed together how this could turn as an opportunity for everyone. So that's it. And group, if you want to complement.
Any further comments from Eleonora's group? I think those are really very good ideas and reflective a little bit of earlier conversations, the importance of networking and the role of umbrella organisations working with their members to actually apply together for relevant funding. Fantastic. Any further comments? Great. Then let's go to Group B, and I had the pleasure of being part of Group B, which was facilitated by Oana, and Dorina has kindly volunteered to give us a little bit of a flavour of the discussions in our group. Dorina, over to you.
Can you hear me?
Very well, thank you.
And you can see me as well.
Absolutely.
The point is I don't see the results of our discussion, and it's due to my complicated network of devices here. Oh, thanks so much, Oana. So helpful. Okay, the good news and the big news is actually that yesterday we have, after 5 years of hard work as an association for stroke and aphasia, we have established the National Day of Bulgaria for Stroke Awareness, and it was headed by a huge press conference. Then at lunchtime, we had the privilege to sign another very important document, which is the memorandum of work between our organization, the municipality of Sofia, and the Sofia University for establishing 10 special cabinets for speech therapy located at the municipality hospitals. And it's a very complicated job that we are just starting it to. And the beautiful thing we headed into was a dialogue with the policymakers and difficult to talk people, asking the questions of patients towards all involved stakeholders in stroke reality. The end was the exhibition with paintings of my mother, that part of them you see in my background, And it was in the heart of Sofia, in a very special place, and it was actually opened as a very special event. So what was in our main focus was actually the barriers. Oana, please feel free to jump in and correct me, because I'm really very much under the pressure of yesterday events, so I might have missed something. The potential barriers, of course, in every SWOT analysis, that's the most important thing. And fundraising is one of the biggest issues that we are already now focusing as well in our little small organization, which apparently tries to make big steps. So governmental versus civil, and the political situation in most of the countries, and changing of policymakers and government people. There was one interesting focus of barriers connected to time, the time needed to come up with all ideas and realize them and make them into reality. And then the time to build reputation. That's something we saw yesterday. Actually, after 5 years, we have been endorsed yesterday by all the stakeholders in the world talking about stroke, like World Stroke Organization, European Stroke Organization, the Stroke Alliance for Europe, and of course, jumping into the potential partnerships within umbrellas. Actually, small organizations like us definitely need the biggest umbrella, and the capacity building must be done with the help of an umbrella organization, because what I see from my personal point of view is patient organizations are very much focused on a personal story and a personally motivated single person, or maybe numbers of persons. And if they have the same, I saw it somewhere in the notes, if they have the same issue and the same focus and the same point of view, then it is rather easy to have the umbrella organization covering the issues and the problems of these small organizations, and work for a capacity building, or for finding funds to make these smaller organizations even stronger. So that's the leveraging opportunities in policy making, of course. The creative part of it. If you our fundraising via the online gallery, and the idea that art therapy helps people with disability to recover much quicker in a much better way, was something that we use as terms of speaking about the huge disabling problems like stroke, and try to turn the point of view for the society into the possibility for art therapy and access to art therapy and speech therapy, and coming back with another identity, if you want to, because the persons, especially after stroke, they have sometimes very, very heavy disability, and they have to learn this new life. So what we face up now, we have neglected this idea to really turn into a huge fundraising idea, this online shop that we have constructed, and we see the potential. And where we miss it, the funds, is the reality that if you have to be working with online digital marketing nowadays, you really need capable people that you need to pay in a proper way. So, but I hope to be able to make a success story of this, and make it really a fundraising tool, as it has to be successful as well. Anything else?
Thank you so much.
I'm missing something. Yeah.
No, I will very quickly. No, thank you so much, Dorina, and congratulations for your achievement yesterday. We also had an interesting discussion about the ability to also leverage the policy environment and link it to fundraising opportunities. And it was mentioned, for example, the European health data space and its implementation will have a lot of grants coming up that will be interesting for patient organizations, but also put more the data in the empower patients and patient organizations with data, and that also increases the value that the extra value that they're bringing to projects. And Derek finished with a very interesting reflection from eSpor about how even more important patient engagement and patient experience data are becoming for the field of health economics, and what the potential is there for also thinking of sustainable fundraising opportunities. And I'll pass it on back to you, Nicola, with thanks again to Dorina and the entire group.
Absolutely. Thank you both. Some very, very interesting ideas shared, and some similar ideas, I think, to what was alluded to by Eleonora earlier too. Let's go to the third group then, Group C. Ivica and Clementine were facilitating that group. Who is going to report back and give us a few ideas shared in that session?
Nicola, I'm not sure Clementina's connection and Melissa is out. I can share insights from our group on what we discussed if you want as a backup. Because Clementina is struggling with connection and Divisa is out. So if you want, because we covered that, I can share a few insights on the last column as well.
That would be fantastic if you looked into the last column. Perfect.
Yes, we did look at that because we had the pleasure of having a patient umbrella organization and of having a few of its members, so we could see the interaction. So when we look at the role of patient organizations and what would be their role, definitely umbrella organizations can act as conveners. And showcasing initiatives is extremely important, and making sure that we have databases available is also an opportunity to then source funding. Industry-wise, we talked about industry supporting in capacity building and supporting by connecting with patient organizations as a convener again, so that the whole ecosystem can come together, come with bigger projects, and then share the outcomes and the burden of running the project per se. So sharing efforts and resources basically was the key. And when it comes to civil society, it was very interesting to hear a few perspectives on how the relationship between the broader civil society and the government can affect healthcare. So we heard a couple of testimonies from CEE of governments having some hostilities with civil society and how this affects. And so partnering with the broader civil society and understanding what is the broader strategy for civil society engagement within the specific context is essential for each patient organization, and is something to be kept in mind for us as global or regional or umbrella organizations when we provide tailored support to them. I hope this was helpful. I don't know if Clem is back and she wants to share anything, but yes.
Anybody who is part of Clementine and Ivica's group wants to add anything? I think that was a very comprehensive overview as well. Again, some really interesting ideas. So before I wrap up a little bit, I just wanted to check, based on what we've heard, if there is any additional input, any additional last thoughts. What we're going to do with the quite intense work of the last hour and 3/4 or so, what we'd like to do is pull this all together with all of the shared learnings and some of the ideas and inspiration, good practice examples, etc., into a guide, a brief guide, so that could be a reference point moving forward. And I guess this guide could be iterative, and we could keep it open so people who have new ideas or new experiences could actually add to that as we move forward. It isn't a topic that we can that we can really find solutions to in a couple of hours of webinar. But I think this has been a really rich exchange and certainly stimulated a lot of thoughts on my side. The Patient Engagement Open Forum virtual sessions happen all year long. And before I close, I'd love to give the opportunity to Aurora to share with us what's coming up next. Over to you.
Absolutely. Thank you so much, Nicola. As you mentioned, the Patient Engagement Open Forum is a year-long co-creation. This session drew from examples from the CEE and was a bit more tailored. But we invite you to join any conversation. You mentioned, Ted, that's our next focus. We're going to have EMA sharing a few insights from the reflection paper. And in the meantime, I see popping up a question for you to rate this session and let us know what you think about it. A follow-up email will share resources with you, including this draft guide, but also a deeper survey so that we know how we can improve. And CEE community, we'd love to know what we can deliver for you next. Next sessions going back there are then a coffee and learn to understand more about Guide MRD. Again, here, CEE community, you may remember, I have Oana, stop sharing. CEE community, you may remember that I have presented Guide MRD and how we got some insights from your community on innovative solutions implemented into care. So there is a session to go deeper into that project, and I do invite you to join that as well. And I think that's it, if I'm not mistaken.
Wonderful. Thank you very much, Eleonora. Oana, any further thoughts to add from your side? I know you've had a very hard day, but any last thoughts from your side?
Yes, I will begin with apologies for my terrible sharing skills. I was trying to participate in the poll and it all went downhill from there. So if the rating has gone down after that, it's because of me. Huge thanks to everyone, to our speakers, and to all of you who have participated in this session, and to our partners from PEOF community and the Synergist. It's only the beginning, and we will continue to bring this topic back to you with more examples and insights. And it's also served as a community of people who always come back. It's hard when you have to do it alone, when you don't have time, when you have to share between so many different things, as Yannick has mentioned. So I hope you also found, beyond strategies and examples, also comfort that you are not alone, and that there are also resilient pathways out of it. And the theme of time always comes back. It does take time. So we are also very happy to support you and try to support you as much as possible along the way. I will also upgrade my slide sharing skills until then. Over to you,
Thank you
Nicola.
so much, Oana. Thank you very much. And again, special thanks to Derek and Ivica for their excellent inputs. It was really very well appreciated, setting the scene beautifully. I wish you all a very nice rest of the day. Stay in touch, and you'll hear certainly from us with regard to the concrete follow-up in the next few days and weeks. Thanks a lot.
Thanks, Nicola. Thanks, Oana. Thanks, everybody.
Thank you,
Thanks,
everyone.
everyone.
Thank you so much.
Bye.
Have a good day.
Thank you.
Bye bye. Bye.